Today, we're diving into something called autoimmune hepatitis. It's a really fascinating and serious condition where the body's own defense system basically gets confused and starts attacking one of its most vital organs, the liver. So, how in the world does this happen? And more importantly, what can be done about it?
So at its core, what are we talking about?
Well, think of your immune system as this super advanced security team, right? It's always on patrol looking for threats. But in autoimmune hepatitis, that security team makes a huge mistake. It gets its signals crossed, misidentifies your own healthy liver cells as bad guys, and launches this full-scale, relentless attack. And that attack is what causes all the inflammation and damage.
And that really gets to the heart of it, doesn't it? What does this internal battle, this friendly fire, actually look and feel like? And how do you possibly win a fight when your own body is the one throwing the punches? That's exactly what we're going to unpack.
All right. First up, let's take a closer look at what we mean by this internal civil war.
The thing to really wrap your head around is this case of mistaken identity. This isn't some virus or toxin coming in from the outside. No, the attack comes from within. For reasons that we're honestly still trying to fully understand, the immune system just forgets. It loses its ability to recognize the liver as part of us and starts this campaign to destroy it.
So, if all this is happening on the inside, how does the body let you know something's wrong? Let's get into the warning signs.
The first alerts are often the things you'd kind of expect with liver trouble, right? Jaundice, that yellowing of the skin and eyes, or pain in your abdomen. But what's really interesting is how the liver's distress can cause these ripple effects, things you might not connect, like acne or changes in the menstrual cycle. It just goes to show how interconnected everything in our body really is.
And because this is fundamentally an immune system problem, the inflammation doesn't always stay put. It can spill over, leading to arthritis in the joints or even nephritis in the kidneys. A doctor might also spot more subtle clues, things like unusual paleness, or even a change in the shape of your fingertips, which all point to a much wider, body-wide inflammatory issue.
Okay, so with all these clues pointing in one direction, the next phase is all about the detective work. You have to get a conclusive diagnosis.
Getting to that final answer isn't just a single event. It's a really methodical process. Think of it like a pathway. You start broad with initial clues, then you narrow it down with specific evidence, you get a visual, and then you get the final concrete proof. Each step logically builds on the one before it. It all kicks off with some basic blood work. High levels of certain liver enzymes, these are the first major red flags. Now, they don't tell you why the liver is in trouble, but they absolutely confirm that it's inflamed and under a lot of stress. And that tells doctors they need to start digging much, much deeper.
And this is where the investigation gets really specific. Now, don't let these acronyms intimidate you. Just think of them as the fingerprints, or maybe the calling cards left behind by those confused immune cells. Finding specific ones, like ANA or SMA, is what helps doctors tell the difference between autoimmune hepatitis and other liver diseases. It's basically how they confirm that the attacker is, in fact, the body's own immune system.
And the final piece of this whole puzzle? That's the liver biopsy. By taking a tiny, tiny sample of liver tissue and looking at it under a microscope, doctors can literally see the attack in progress. They can see the immune cells. They can see the damage they're causing firsthand. This is the direct, physical evidence they need for that definitive diagnosis.
So once that diagnosis is confirmed, the entire focus shifts. It's no longer about finding the problem, it's all about managing it.
And managing autoimmune hepatitis isn't a solo job. It absolutely requires a team of specialists. You've got the liver specialist, the hepatologist leading the charge. But because this condition affects the whole body, you also need experts like dietitians to provide that comprehensive, long-term care. The treatment plan is like a medical toolkit with different tools for different jobs. You've got steroids, which are like the rapid response team, coming in to put out the fire of inflammation really quickly. Then you have other drugs like Azathioprine that work over the long term to basically tell the overactive immune system to stand down. And of course, in the most severe cases where the liver damage is just too far gone, a transplant becomes a truly life-saving option.
So, why is this proactive treatment so absolutely critical? Let's take a look at the two very different paths this can take.
The two paths forward here could not be more different. With management, the immune attack gets under control. The liver gets a chance to heal, and the risk of complications plummet. But without management, that unchecked inflammation just keeps going, leading to permanent scarring, that's called cirrhosis, which can eventually progress to life-threatening liver failure. This contrast makes it so clear why treatment isn't just an option, it's absolutely essential. And the risks here go way, way beyond the liver. An immune system that's just out of control can cause systemic damage, affecting everything from your heart and blood vessels to your risk of getting infections. So managing this condition is really about protecting your entire body's health.
And that really shifts the whole perspective, doesn't it? The goal isn't some one-time cure to win a single battle. It's about consistent, long-term management of a chronic condition. It's about protecting the liver and really a person's entire future from any more harm.
And that leaves us with this final thought. When the body literally turns on itself, the solution isn't to just fight back harder. It's about a dedicated team of experts, using really careful strategies to restore balance and to help the body get back to doing what it does best, protecting, not attacking, itself.